Hello and welcome to Health Hope. We know that your health is important, so we have designed this program especially for you. Through interviews with health and wellness professionals and stories of those who have overcome difficult life experiences, we want to bring you the most up-to-date information and current trends on health and wellness. Thank you for joining us today. I'm Gail McKenzie and I'm your host. Today we have with us again, returning, Dr. Holly Martz. I'm so glad that you're back with us again, and today we're going to talk about a very important subject, diabetes. Can you first of all tell me, what is diabetes?
Well, diabetes is a very common disease state. You've probably all heard of it before, but may not understand what it really means. To put it simply, patients with diabetes have too much sugar or glucose in their bloodstream.
Oh, that's that word sugar again. I like that, sugar, but is there more than one kind of diabetes?
There are actually multiple kinds of diabetes I can think of, but for simplicity's sake, we're just going to talk about the two most common types tonight.
Okay. Now, what causes type 1 diabetes?
Type 1 diabetes is mostly seen in young children or adults up to the age of 25. It's an autoimmune disease. Auto means self in medicine, so that means that your own immune system is attacking your pancreas, and eventually the cells in the pancreas die and they don't make insulin anymore.
Wow.
And
that doesn't sound good, does it?
No. When I first heard of that, I thought, well, how could that happen? Why would your immune system attack yourself? Well, think about what a miracle it is that your immune system doesn't attack your entire body. It's prone to fight enemies, and your body has to be able to tell the difference between you and all those viruses and bugs out there that you get sick with. And so patients who get type 1 diabetes, they have immune systems that get confused. The genes involved in this allow them to mistake the pancreas, the beta cells specifically that make insulin. It mistakes them for a virus that the patient had in the recent past.
Okay. Now there's also a diabetes 2, type 2. What causes that?
Type 2 diabetes is way more common. That's 95% of the patients with diabetes have type 2. And type 2 diabetes is caused by insulin resistance. So in the beginning especially, these patients have plenty of insulin. Their cells just don't know how to recognize it. They're not listening to the insulin that brings the sugar into the cells, and so the sugar stays in the bloodstream.
Okay, all right. Could you have both types, type 1 and type 2?
I've actually known a patient who had both, and I'm sure there's more out there. It's somebody who started out with childhood type 1 diabetes. They don't have the insulin anymore, and then as they get older, their diet's not as good, they may gain weight, they can develop insulin resistance on top of that.
Now, I have heard of something, it's kind of unusual, but I have heard that there is a type 1/2. What would that be, and what would cause the type 1/2?
So type 1.5 diabetes is really more like a type 1, but instead of their immune system attacking their pancreas and just wiping out those beta cells all at once, it does it more gradually over time. And so those patients may actually respond to treatment for type 2 diabetes early on, but they end up on a path to needing insulin a lot more quickly than you would expect with just pure type 2 diabetes.
I would like to ask you a question. Can thin people get type 2 diabetes? Because you think of thin people being very, very healthy. Do they get diabetes, or or obese people? Do they get diabetes, or type 2, 1, 2? What with weight? What does that matter? Does it make a difference?
I have many thin patients with type 2 diabetes. That's where their genes are primarily driving the insulin resistance. Some of the largest patients I've had in the 400 and 500 range, I've had some of those who don't have any diabetes at all. So it doesn't necessarily mean that if you're a certain weight you can avoid it, or if you're a certain weight you're going to get it. Those genes really do come into play in your lifestyle. I know a lot of people who are thin. They're lucky to be thin, but they eat terribly, they don't exercise. They call them the unhealthy thin.
Okay, unhealthy thin. I'll remember that then. All right. Is diabetes an inevitable part of us aging, as we have those birthdays that come every year and we get into our later years? Does that mean that we're going to get diabetes?
So not necessarily. I do have several elderly patients in their 80s that, as I've known them over the years, they're fasting sugar is creeping up, and
Okay.
so they would be classified as a diabetic, but it's not going to, at that point, shorten their lifespan, and I certainly don't tell my 86-year-old patient who loves to bake that she can't bake anymore.
Okay, all right. So those birthdays are not going to mean that
Right.
we're going to get diabetes.
But I also have many patients, even up to 90, who don't have any sugar abnormalities, so it's not a given that it will happen.
Okay, so what you're saying really is genetics and diet have a lot to do then with if you're going to get diabetes. Let me ask you this: how common is diabetes in the United States, in our country here?
It's probably one of the most common diseases that I treat as a primary care physician. As of 2010, when this data was last collected, I think they estimated 26 million Americans have type 2 diabetes. And of those, 19 million are diagnosed, and a full 7 million are estimated to be undiagnosed.
Really? It is that high? Wow, that's pretty incredible, isn't it? Well, let me ask you another question now. Are men and women, or women, at a higher risk, either gender? Is there a statistic that tells us, you know, who might get diabetes?
The good news for you, Gail, is that there's no gender battle on this one.
Okay.
Women and men
All
get
right.
diabetes at equal rates.
Really? So that has nothing to do with it?
No.
Okay. Is the prevalence of diabetes the same in different ethnic groups then?
It's actually not.
Okay.
So in Caucasian populations in America, it's about 7%. In Asians, a little over 8%. In Hispanics, just under 12%. African Americans have about 12.5%, and the highest is 14% of Native American Indians.
Wow. Okay. That's kind of interesting, isn't it? Now let me ask you this: has the overall prevalence of diabetes, have we seen a change over time, over the years? Has anything fluctuated as far as more or less that have diabetes?
It's been a dramatic increase. In the past 10 years, the percentage has gone up 100%, which is basically doubling the number of patients.
You're kidding. 100%. Wow. That's tough, isn't it?
As you can probably guess, it went up along with the incidence of obesity during that same time period.
Okay, okay. Now let me ask you, what does pre-diabetes mean? I've heard that term before. What would, if somebody's told that they're in a pre-diabetes state or whatever, what would that mean?
So this has many different names: pre-diabetes, glucose intolerance, impaired fasting glucose. Basically what it means is that you're on that path to diabetes. I mean, it's a spectrum. You don't just one day wake up and have diabetes, you know, except for a type 1 could one day wake up and have it. But for type 2, it's a gradual, slow process. And these are patients who are nearing type 2 diabetes, but they don't quite have it yet.
Okay. What would be some of the symptoms of that? Can I ask you that?
Of pre-diabetes?
Yes.
Nothing. They would feel nothing.
Oh, okay. So they really wouldn't even know that they have it. If I have diabetes, the question would be is how would I be treated? What is the best treatment? And when I go to my physician, what could I expect that he's going to do or have me do?
So it depends on the kind. So for type 1, the only option is insulin. Okay? They don't have the option to just do lifestyle changes, although that would be encouraged of any diabetic. But type 1 patients must have insulin. They have none. They need it just to survive, even if they were never to eat. As far as type 2 diabetics go, lifestyle is probably the #1 thing that the doctor will recommend, but it depends how severe it is. If you're diagnosed with severe type 2 diabetes, you know, and your numbers are a certain degree of elevation, there's no way that lifestyle at that point alone is going to do it. You probably would need insulin if it's severe enough. If it's in between mild and severe, you might be offered a trial of oral medications or non-insulin injections. Some of these pills tell your pancreas to pump out more insulin, and some of these pills tell your body to recognize the insulin better, because that's the real problem of type 2 diabetes, again, is recognition of insulin at the cellular level. But no matter which therapy you get, even if your diabetes is severe enough to need insulin or to still need pills, again, the lifestyle changes are really recommended because, for one thing, you're going to have better health overall if you do these things with other disease states. but especially it's going to lessen the amount of insulin you would need. It would lessen the amount of pills you need. I have some patients that need 4 or 5 different kinds of pills at maximum doses just to keep their levels correct. And if they were doing lifestyle at the same time, it might not mean they don't need any pills, but they might be able to take, say, 1 or 2 and have a lower dose of it.
Right. Wow. So we know that lifestyle is so important, isn't it? And exercise is one of those components. How does exercise help a type 1 diabetic?
It doesn't help a type 1 diabetic, but it would help. Well, it would help them for other reasons,
yes,
but it wouldn't get to the root of the problem.
Okay, but a type 2, it would.
Yes,
it would make a difference.
Absolutely. So
yes.
Exercise itself directly reduces insulin resistance.
Okay, so we want to exercise
yes.
even if we're borderline. We would want to get out there and do that exercise. Are there any natural supplements that can lower blood sugar that a type 2 diabetic could take?
There have been a lot of them that have been touted to do this. I've heard of cinnamon, I've heard of fenugreek, chromium has been said to do this for years, alpha-lipoic acid, I've heard about that one. So I've actually done some research on this, not personal lab research myself, but going through the literature and seeing what it has to say. And on my review of the literature as recently as this month, the best support would be for cinnamon and fenugreek. Actually, a recent study of chromium failed abysmally. It didn't do anything compared to placebo. Okay. Alpha-lipoic acid, I wasn't impressed with what I read. But the key with the supplements is, especially with the cinnamon and the fenugreek that we're saying could have an impact, is A, your doctor needs to know you're doing these, because if you're on insulin or you're on pills that can cause hypoglycemia or low blood sugar and all of a sudden you start one of these supplements and they don't know, you can bottom out your sugar, which can be very dangerous.
Right, oh yeah.
The other thing is, herbs, when they have good properties, can also have bad properties.
They have some side effects too, don't they?
Exactly
yes,
like any other medication. Just because it's an herb doesn't mean it's safe. For example, fenugreek can increase bleeding risk. So if you went into surgery and didn't tell your surgeon you were taking it, that could be bad.
Okay.
If you were pregnant and had gestational diabetes and said, I heard that fenugreek can do something, let me just take that. Well, it can increase uterine contractions and put you into early labor. So always use herbs in conjunction with your physician's knowledge.
Right. Right, very important, yes, okay. Now, we've kind of answered some of this with diabetes 1, but is diabetes curable? Can you get over it? Can you cure it?
The answer is resoundingly no. As much as people would like to think that they can, it is never curable. Even my best patient I've ever had who was gung-ho with the lifestyle changes and went out and did it, she came back and asked me, okay, I've dieted, I've exercised, I've lost all this weight, my numbers are beautiful now, they're back into the normal range. I want to tell my friends I don't have diabetes anymore. And I said, the minute you say I don't have diabetes anymore, you stop treating it. I told her, you avoided insulin and pills, but the lifestyle changes were your treatment. So now you are a lifestyle-controlled diabetic. The same way I can give someone insulin or a pill and get their sugar in the normal range, but that doesn't mean they're not diabetic, neither for you. And so this star pupil of mine eventually did creep back into her old ways. The numbers went up, and I said, see, this is why I told you you're still a diabetic. And she's since gotten back on the straight and narrow.
She's on her way, yeah. So that goes for then, just to clarify, that means that type 2 you cannot cure either, because I've kind of heard that type 2 you can actually reverse.
Well, actually, that was the one I was speaking to.
Oh,
so
okay.
let me clarify.
So she is type 2.
She was a type 2, and she changed
All
it with lifestyle. Because again, type 1 can never be
good.
changed with lifestyle. They are empty of insulin.
There is no. Okay.
So type 1 is never curable,
important.
and type 2 can be put into remission.
Okay.
But I never let the patient say that they don't have diabetes anymore. Once a diabetic, always a diabetic.
Okay. Well, now if a person is type 2 diabetic and they want to exercise, part of that lifestyle change, which we keep hearing that word over and over again, lifestyle change, how much should they exercise? I mean, do they run marathons or just, a mile a day? What kind of exercise would you recommend?
So I've seen patients get real gung-ho and go crazy, an hour, 7 days a week, and then 3 weeks later they're burned out and they don't feel like exercising again for a year. So I had a wise professor in my physical education classes in college say to me, the best exercise, and we're all waiting with bated breath, what's the answer?
Right. I'm waiting here, okay.
The best exercise is the one you will do. So for you, it might be different than for your husband or your sister. The one that you enjoy and that you can actually do on a consistent basis is the best one for you. And so I usually say do something more realistic, 30 minutes at a time, and do it 4 or 5 days a week. Give yourself 2 or 3 days off.
The key would not to be too easy on yourself, right?
Yeah.
The one that you do, well, okay. Now, what about if I have type 2 diabetes and I'm overweight? How many pounds would I need to lose? Let's say, I don't know, let's say I was 100 pounds overweight. How close do I need to get to my, basic minimum weight or the, ideal weight, I should say? What do I have to do?
I get asked that question a lot by my patients. What's my magic number? I get asked that about the diabetics, the high blood pressure patients. It really varies from patient to patient, because if I see a patient with type 2 diabetes who's overweight, how do I know that they're not a thin person hiding in that body who would still have diabetes? Because again, I've had thin patients with diabetes. Also, again, I've had the opposite. So I tell them there is no magic number. You might lose 10 and it might make a big difference for you, or you might have to lose 50 and still it will help. Every little bit will help. But as far as whether you can guarantee that enough weight loss will get you in remission, there's no guarantee.
Okay. Well, now we've also talked, when we talk about lifestyle, it's not just exercise, it's also diet. It's the food we eat. So what kind of foods and what kind of diet would a diabetic have to eat? And what would you recommend?
So I try to give them general principles at first. Like, think of sugar more broadly than you usually do. We all think of sugar as table sugar, cane sugar. We read labels in America, we flip it over and see how many grams of sugar are on that label. But sugar is not just S-U-G-A-R. It's anything that is made from refined wheat flour, enriched wheat flour. Enriched wheat flour sounds so pretty and good, right?
It does.
Enriched wheat flour means they had to enrich it with everything they ripped out of it when they ground it up to nothing. It's not whole grain anymore. So I tell patients avoid sugar, flour, and starch. As much
all three white, aren't they?
As possible. Yes. But of course, I much prefer starches that God made. I'm never going to be part of that group that thinks that a potato is evil. God made a potato. I think He had good reason for that. And sweet potatoes actually are helpful for diabetics, believe it or not. Even though they have the word sweet in front of them, they're better for diabetics than white potatoes. But as far as whether I'm going to recommend Weight Watchers or Sugar Busters or the Perfect 10 diet, it really depends on you. I loved the Perfect 10 diet in theory, but I'm a vegetarian, and there was a lot of meat in that particular diet, and they kind of knocked soy, which soy is one of the ways I get my protein. So for me it wouldn't work, but I have recommended the Perfect 10 diet to some of my meat-eating patients that I have. So in the end, it goes back to the exercise advice of my teacher in college. The best diet is the one that you can stick with, the one that works for you with your lifestyle. But I do recommend a lot of support and writing things down, because serving sizes have gone way up in America over the years, and it's really easy to eat a lot of calories and not realize it and think, I'm not really eating that much. But when you write it down and you look at servings, you'll sometimes see
that it's more than what you thought it was. Yes. Well, then that kind of answers my question, but I have a really big question. If I'm a diabetic, do I have to give up desserts and all those wonderful foods that I enjoy? I mean,
No.
You said white flour and that kind of thing, but what about desserts?
I first asked them, well, how often are you eating these desserts? I have patients that have to have dessert with every meal, and I have some that have it once a week or once a month, so it would depend on that. So I never want you to give up everything you love, because just like the exercise, you'll do it for a few weeks gung-ho, and then you'll just throw out everything and you'll stop doing it. So I say do something you like if you can do it in moderation. The further out you get from eating so many sweets, the less you will crave them over time. I suggest to some of my patients that they substitute dark chocolate. If you have a sweet craving, particularly in the evening, dark chocolate has a lot of health benefits and less sugar. And I'm not talking Hershey's dark chocolate, which still has a lot of sugar in it.
I'm thinking, boy, everybody's jumping on that. Ooh, chocolate, all right.
I'm talking about the real dark chocolate, like 70% cocoa, 72% cocoa. If it's not your thing initially, over time, you'll get used to it. They come in these big bars with, 8 pieces. You can cut it up. And I say have 1 or 2 of the pieces that you cut up in the evening, and it usually will curb curb your sweet craving. Over time, if you think it's bitter in the beginning, you'll think it's sweet down the line. And then real sweet things, you'll say, ugh, that's a little bit too much.
Yeah. Well, everybody needs a little something, don't they, occasionally? Well, now what about, I know that there are sugar-free desserts. I mean, you see them on the shelves in the grocery store. And are those good for you? Should you use the sugar-free desserts or stick with the dark chocolate, like you said, for that little bit of sugar or sweet taste that we want?
One trap with the sugar-free is that it says sugar-free, so it's got no cane sugar, but it's often full of enriched wheat flour. So we're back to the sugar in disguise, full of flour, and then they'll put an artificial sweetener in there. On top of that, it keeps your palate wanting sweet stuff. Those artificial sweeteners are very sweet, so you're not getting further away from the cravings. You're keeping your palate used to that kind of thing. Having said that, for your actual blood sugar, it's certainly better to do an artificial sweetener than the cane sugar, but watch out for the flour.
Right. So what you're really saying is we have to train ourselves, don't we, to eat a different way, to exercise, even our taste buds. We've got to train those to be different, don't we? Yes. Now, I know that this is another question. If I am a diabetic and I'm taking insulin, can I just eat whatever I want? Because I've got the insulin, so that should take care of all the problems I have. Is that true?
No. If you eat whatever you want and do whatever you want, you absolutely will need way more insulin.
Okay.
I've seen people need 150 units of insulin because they're not doing the lifestyle things, and they might have been able to get away with 1/3 of that.
Okay. And their overall health probably is not as good.
Correct.
Right. I would think that would make a difference.
And over time, you know, if you're not doing the diet, over time the pancreas will get exhausted trying to pump out extra insulin to do the same job because of the resistance problem. And so anything you can do to help the pancreas, give it a rest and not let it get so exhausted pumping out the extra insulin because of the way that you're eating, that'll help preserve the life of your pancreas for longer.
Okay. Is there anything else that we could do if we're diabetic? Any other lifestyle changes besides diet and exercise and the medication? Is there something we've left out here?
It's just like the doctor tells you when you have a heart attack. De-stress your life. Stress raises cortisol level, and one of cortisol's jobs is to increase the sugar level in your blood. Okay. So if you can remove some stress from your life, that will actually help your blood sugar. I've had patients who were in great pain from either dental pain or back pain or whatnot, or an infection that they have, and their sugar just goes up because of the stress and the cortisol. Right.
Do pills and non-insulin injections cause weight gain? I know that's, you know, I have a friend who worries about that because she now has to start taking insulin and she's doing injections and she's so afraid she's going to gain weight. Is that a side effect of insulin?
Insulin absolutely will cause weight gain, which is why if you can do the lifestyle changes, it's better. Because insulin doesn't just store glucose. It takes glucose out of the bloodstream and stores it in the cells, but it also stores fat. So the more insulin you have around, the more you will store the fat that you eat as well.
Okay. Wow. Okay. Now, what happens if a person has diabetes and doesn't get any treatment? If they just keep getting sicker and sicker, what will eventually happen to them?
Again, it depends on the type of diabetes. So type 1 diabetes, without insulin, the patient will die. There's no choice. They must have their insulin. Again, even if they were never to eat, they need insulin just for their body to function. As far as the type 2 diabetes goes, without treatment, you have end organ damage eventually, which would mean increasing risk of vascular disease, heart disease, and stroke. The extra sugar puts a lot of strain on your kidneys. You can end up in kidney failure, dialysis. The extra sugar damages your nerves. So you can have nerve damage as well. I have a lot of patients with painful peripheral neuropathy in their legs. And vision, it's the #1 cause of adult acquired blindness in this country.
I did have a friend who actually went blind from diabetes, yes, so I know that that's a real risk.
And for the men out there, I've had a lot of men who this is the only reason they want to treat their diabetes. Erectile dysfunction is often a cause of diabetes. Again, it goes to the damage of the arteries and the nerves.
Okay, all right, very important to understand and to know. So how can I find out if I have diabetes? How is it diagnosed?
In the old days, it was pretty complicated. Lucky for me, in my day of practicing medicine, there's a real simple test. It does not even require fasting.
Oh, really?
So it's called the hemoglobin A1C, or we call it the A1C for short, and it's very good because it doesn't lie. Not to call my patients liars, but you know, in the old days I had to rely on them, once they were diabetic especially, checking their sugars and giving me the readings. And this averages your sugars for a full 3 months. So it averages the sugars while you're fasting, while you eat, you know, pre-meals, post-meal, while you sleep, while you're awake, 24/7 looking back. So if I get a sugar, say, you know, today, July 26, if I get an A1C, then that tells me how my patient's sugars have been since April.
Right. Now, what kind of a doctor would I look for if I suspect that I have diabetes? Who would I go to? What kind of physician? Is there a specialist? What do I look for in the directory or ask friends? Who would I go see?
So your primary care physician, a family practice doctor or an internal medicine doctor, would be capable of diagnosing the diabetes for you.
Okay. And so now do some diabetics have to have specialists? Are there specialists?
Yes. So for those who have the end organ damage we talked about that can come from not treating the diabetes, some of mine see kidney specialists if they've had the kidney damage, or even if you've not had any damage to your eyes yet, every diabetic annually gets a screening exam to see if they have the damage, because they wouldn't notice the difference until it was too late.
Is there a Bible verse that you'd like to leave with us, just to give some encouragement and hope to those who are our viewing audience today?
So I like 1 Corinthians 6, verses 19 and 20, that says, "Do you not know that your body is the temple of the Holy Spirit, who is in you, who you receive from God, and that you are not your own?" Basically says glorify and honor God with your body at the very end of that verse. And I like that because that's what reminds me, nobody can control whether they have the bad genes that predispose them to diabetes, whether it's type 1 or type 2. And I do think to some degree God holds us accountable for how we treat our bodies and whether we're going to take care of the vessels or temples that He gave us.
Right. Dr. Martz, thank you for being with us today. I know that our viewing audience has learned a lot. I know I have. And I want to thank our viewers for joining us today with Health Hope. I hope that you have learned something new and that you will be healthy and well. So remember, health is the goal and hope is the anchor.